So what do you call yourself? Welcome to the LaTangela Show.
Hey, what can I do for you this fine day?
This is your destiny. Hot, hot, hot.
Right now.
Welcome to the LaTangela Show.
Kick it!
Come on in and enjoy yourself.
Right now.
We gon' party like no one else. Welcome to the LaTangela Show.
Hi, and welcome back to another episode of the LaTangela Show podcast. You know, it does my heart well to have this time together. And we are indeed recording at the garage. Thank you so much to Gordon McKernan Injury Attorneys, our partnership with Gordon Gibbs and Tan Cares, highlighting those who are making headline news for all of the right reasons. If you would like to be a guest, if you know of a nonprofit organization, or if you're working with a nonprofit organization, we'd love to see how we can best work together. Might be able to bring some funds to have some additional fun, and definitely would love to have you in the hot seat on the tan line. Submit your information at latangela.com. Now today we're going to chop it up and talk to none other than Miss Renita Williams Thomas. Now she is the mastermind, the brilliant and pure heart behind In Loving Arms. From medically fragile children, straight from NICU graduations, all the way up to 12 years of age. Now, when you start talking about a story behind the story, you can't afford to miss this one. When I tell you that God understands exactly what he's doing when he's doing it, and he's gifting the vision to those who he know will do the right thing, in this season, it's more important than ever to highlight those who are pushing the initiative forward in the right direction for the right reasons, because now is indeed the right time.
Hi, and welcome back to another episode of the LaTangela Show podcast. You know, it does my heart well to have this time together, especially as we're chopping it up with the world's greatest. And I love to say the world's greatest because it's always the hearts behind the purpose and the passion that's moving all of these initiatives forward in the right direction. And today we're going to learn a lot about In Loving Arms, but I love a good story behind the story. None other than Miss Renita Williams Thomas. How are you?
I'm wonderful, and thank you for having me today.
No, thank you for taking time out of your schedule. I know how busy you are. It's like you're all over the place doing things that's just fabulous and from a loving space and in the spirit of excellence.
Well, that's what my intentions are always in, making sure that I take care of the children of Baton Rouge.
Absolutely. Tell me a little bit about In Loving Arms, some of the services that you all provide.
Okay. In Loving Arms Pediatric Day Health Center is a daycare for medically fragile children. So breathing tubes, feeding tubes, respirators, ventilators, rare genetic syndromes. We care for those children so moms can go back to work or go back to school.
And this is something that came to you as a part of a purpose and a passion that filled a void that found you.
Absolutely.
Now, you've been on the scene taking care of us for many years, so thank you for your continued service and your heart and your dedication in that. But there's something that was so deep and so moving, and years ago, you shared a story with me about how all of this came about. And I just want you to share a piece of that with the world.
Well, thank you for allowing me to share that. But I adopted a little girl from foster care. And after adopting that little girl, or when I began to foster her and got ready to go back to work, because I was a registered nurse at Our Lady of the Lake Hospital for greater than 15 years at that point, there wasn't a daycare center that could care for a child after they were released from the hospital that was medically fragile. So we created a daycare for medically fragile children so that those parents would have an outlet or a place where RNs, LPNs, medical assistants, occupational speech, and physical therapists were under one roof. So essentially a home health agency within four walls.
Wow, but God.
That's exactly
But
right.
God, he knew exactly what he was doing.
Absolutely.
When he placed that baby in your care. Because from that, you received the notion to say, I'm going to put this forward and not just do it for mine, but for others who need the same care. And for the parents who actually need the assistance in making sure that somebody's providing all of the needs of their child in the same amount of loving care that they would. Some of the things when you say medically fragile, explain to us what that may look like.
Okay. Medically fragile can be anything from a child that's just born premature, that's just a little bit smaller than they need to be, to someone that has a congenital anomaly that will forever be afflicted with that deviation. So some things that we may have are congenital lung disorder. We have children that were born without kidneys. We have kids that were born with part of their brain. So when you say medically fragile, there's some skilled nursing intervention that a nurse has to do for that child every day in order for them to be whole again.
And this is not a cookie cutter process.
No,
every child is different, from their needs to even just how they are to be cared for. Your team, this can't just be someone who's walking in volunteering their services, because, these senses are even more heightened with the care of the child. So what does it look like for the team of In Loving Care?
Okay, so the team for In Loving Arms, and you're absolutely correct, there's a plan of care for each child. In addition to that, there's an educational plan so that the educational needs are not deviated from while we're doing the medical. So our team is, like we said, the RNs, the LPN, the medical assistants, whether they need occupational speech or physical therapy during that day. Also, so that transportation is not a barrier to care, we provide daily transportation with a nurse on board in the morning and the afternoon.
Wait a second, you're taking me fast. Not only do you provide all of the services, the wraparound services, the care with the professional team, but you're also doing the transportation. So it's a holistic approach for everything from the child's education, health, transportation, and alleviating all of that stress from a parent, a guardian, so they can get back to some sense of normalcy and to be able to care for their child.
Right, and understanding and knowing that they are in loving arms, and every care that they've thought of as a mother, I thought of it first. So it's right there for them to take advantage of.
Well, how long have you all been operating?
Okay, well, we started the vision when she was adopted, so she's 16, so 15 years, but we've been licensed for the past 12 years.
Congratulations. And she's 16 now?
She's 16, precious 16.
Oh,
yes.
wow. Time flies.
It does.
And I know that these babies, they're growing so fast.
They are.
And the parents, as a new parent, or maybe even as a parent of an additional child, every child has unique needs.
Absolutely.
So even when they come and they have these fragile situations, they're learning more about how to deal and how to cope. Do you have any of those wraparound services for the parents?
And absolutely great question. We do have a social worker that works with us, and also a behavior specialist or mental health, because when you bring this child home, you're expecting the perfect child. And when you bring a child home, and by the time you get home and get them settled, you go, now what do I do? All of my support from the hospital is gone. So we do have service delivery for parents, and not just in Loving Arms parents, but any parent in the community that may need some additional help with a child that has a deviation. They can give us a call as well, and we can set up some consultations with them as well.
That's right. And I know that you and your team, you're doing some amazing work right here in the capital city, 2315 Harding Boulevard. Now is the time to give her a call at 225-359-9798. I'm trying to remember all of my questions because you do so much and I don't want to leave anything out. The age range for the kids.
Excellent.
Let's talk about that. So from infant until...
So we care for children from NICU graduates, or the ones just leaving the NICU, till 12 years old. So generally we keep the kids till they go to kindergarten.
Okay.
But once they go to kindergarten, for summer programs, they can come back to us until their 12th birthday, and we can continue to care for them. So prepubertal children from infants to 12 years old.
Now, how do you select the children? Do you have open enrollment during certain times? Must they come to you through a social worker or be medically provided by a provider? How does that work?
Excellent question as well. So they can be referred by the physician, they can be referred by WIC, they can be referred by someone at the church, or they can self-refer and they can just walk in and say, my child needs the services. So once they do walk off the street, we do send information to their physician's office, which is a referral form that they must sign verifying the severity of the disability so that we can care for them in building a care plan to meet their needs.
Now, building out those care plans, having limited space,
Yes.
having such a professional team and an ongoing staff and transportation, all of this is starting to sound like cha-ching, cha-ching, cha-ching to an already overstressed family.
Yes.
Tell me a little bit about those payment plans or even the cost associated with something like this.
Surprisingly enough, the state of Louisiana implemented the service so that Medicaid pays 100% and there's no out-of-pocket for the parent. That includes the transportation as well. Some of the insurance companies, such as Blue Cross and some of the other insurance companies, they pay their portion, and the parent may pay a deductible, which is the same as a medical deductible, because they do realize it is a medical service, and they realize that early intervention affects the child in a more positive way as they grow older.
Wow. Wow. We can't say thank you enough for the work that you're doing, for the attention to detail that you've given, and for even answering the call. Because when God gave you this vision, he gave it to you for a reason. He knew that you would do the right thing for it and that people would benefit from a heart like yours. And we appreciate you so much. I want you to always think of this as an extension of your office. I love to tell the stories that's making headline news for all of the right reasons. Because too often all of the other stuff, the trash, is going to find you. Absolutely. You know, and I don't want to spread any more of that depression, because it's depressing enough for me having to report it day in and day out, either knowing who it happened to or who did it. Like, that's not helping us at all. Right? So when we start finding these solutions, like in Loving Arms, now is the time to talk about it. Renita Williams-Thomas and her team. I want you to log on and check them out right now. InLovingArmsKids.com. Again, that's InLovingArmsKids.com. You want to make the field trip? 2315 Harding Boulevard. About how many kids can you hold? What is the capacity for that?
We're the largest single licensed facility in the state of Louisiana, so we're licensed for 70 children here in Baton Rouge.
Wow.
Yes,
that is good.
Small hospital.
Yeah, so now is the time. If you know that you are in need, or as a matter of fact, send this out as a subtweet. Let it find whomsoever may need it. Give them a call at 225-359-9798. In your many years in this field, what are some of the words of encouragement that you would like to give? Just recently, we were at the Nurses Power Brunch, and it was a room full of loving hearts.
Absolutely.
And they look up to you and the work that you've done and the vision that you've made clear for so many.
So I guess the words of encouragement is, this too shall pass. And no matter how dire the situation of a family that they're faced with, there's an option and there are possibilities. So we need to look at the greater picture and know that, utilize those resources, but know that this too shall pass. And we're here to help you.
I love it. Look, I know you have more work to do, so I'm going to let you chase the sun or let the sun chase you. But either way, get after it. I love you, and there's absolutely nothing you can do about it.
I love you as well. Thank you for your time today.
Now, I have some random research for you. You know, I'm the queen of random research. I was bothering none other than Brandon today while we were filming and doing some show prep, and he said, "Ten, why do you come up with this stuff? Why are you picking on me?" Because all of a sudden he just felt like I was picking on him. I said, "Oh, okay, fragile much? Happy fruits, happy veggies." Clearly, he did not have his fruits or veggies today, because this one caught him off guard and knocked him off his rocker. Did you know that if you eat a couple more servings of your fruits and vegetables a day, that you will be a happier camper? Now, follow me, we're going somewhere. This is PLOS One, a research publication, and they stated that if you add more fruits, add more veggies, it reduces depression, it reduces anxiety, it increases happiness, and leads to a higher social emotional well-being. And it does it in as little as 2 weeks. So if you're getting the case of the summer blues and life just isn't doing what you needed to do right now, go get you a stalk of celery, get you some banana, get you a kiwi, or maybe even an orange. Whatever it takes, get your fruits, get your veggies. As a matter of fact, I've been doing better. I've been adding my cucumbers and my lemons and my little ginger, making my own tea, because I'm not myself until I've had my tea. Yeah, that's where we are. And Brandon, would you say I'm happier today than not?
Oh, yeah.
Okay, yeah, kind of, sort of. No, not really. Did you know that National Be a Kid Again Day is really a thing? I did not know that, and I'd hate for us to miss it, even though we may have to add some additional days on the calendar for this one. July 8th is National Be a Kid Again Day. Now, it's the perfect day for families to say, you know what, I'm going to embrace my inner child. I'm going to work and say, you know, I missed it, so this is what I'm going to do. I'm going to implement my own nap time. I'm going to have recess. I'm going to color. And what else I need to do? Probably even watch Miss Rachel. I don't know. Whatever it is that she's doing to have these kids so wrapped up. Hi, I'm watching her today too, because she clearly puts everybody in a better mood. So there you have it. Dinkwad. Have you heard of Dinkwad? You may be a part of Dinkwad Nation. Let me tell you about it. Now, Dinkwads, it describes a family that is double income, no kids, with a dog. Who came up with this? Like, okay, so both of you are working, you don't have kids, but you have a dog, so they just named you Dinkwad? Yes, yeah, absolutely. And you know, it actually revolves around pets versus people. Now, according to Darwin's, a dog food company, they have some research that states that just 61% of other dog owners state that they don't want to be called a dinkwad, even if they are. Okay, well, Webster's Dictionary might want to just leave this one out of the running. But this is something your pooch, little fur baby, might be a little upset at me about. So I'm going to leave this one to you, and you take this information as you will. If your pooch is putting on some extra pounds around the pouch, it might be enough time for you and them to step away from that food bowl. Add some water. I know I told you about your fruits and veggies. I get it. I've been doing the research because 'tis the season for us all to get it right. The problem is you're giving them too many treats. I was like, wait, who is trying to cut off our treats? And they really are. And maybe it's that time. Now, if you do the math, you're feeding about twice the recommended number of calories to your dog. And that's why their poor little pooch is gaining those extra little pounds. And if you're noticing that the dog is gaining the same amount of weight, it's because y'all are snacking together. So now we can't snack together, we gotta walk together. I'm here for it. Did you get your steps in today? Mental, physical, spiritual, it's all important. And sometimes it may look a little different than other days. So some days I have to go outside and knock the dust off my punching bag. Some days it might look like a ride or a roll with Peloton. And some days it very well may look like me cooking one of my favorite recipes. So my kitchen smells like my grandmother's kitchen, and it just takes me to a happier space. But whatever it is, you need to find your space of happiness, your space of peace, and your space of well-being, because it is indeed very much important. Now, you know, I got a lot coming up for you, but this is something that I found was quite scary. AI knows us a little better than it should. Artificial intelligence. Everybody's being replaced by these robots these days, and robots are thinking for us. And artificial intelligence might be something so simple that we don't even realize we're depending on it. But now research is showing that it knows our next move before we even tell it what we're gonna do. Have you noticed that? From geofencing to them learning how to stalk us with our permission, it's starting to get spooky. At this point, I think I just need some yellow pages in a phone book versus Google. I don't mind an atlas versus an app to show me how to get right or left. And I'm almost okay with going back to a rotary phone. Digga, 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 digga. Wait, digga, 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 digga. Do you remember the rotary? Digga, 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 digga. And don't mess up, because then you gotta stop and start all. Digga, 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 digga. I'm like, well, you know what? This phone call, a rotary phone would stop us from calling the people we don't need to be talking to in the first place. Because who has the time to sit there and go through all that digga, 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 digga. Digga, 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 digga. You know what? I gotta go. You keep it locked right where you have it.